everyone. Welcome to KHA Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Sweta Singh, our KHA Chief Administrator, will start the session.
Hello everyone. As our KHA Chief Administrator, Dr. Shweta ma'am is not with us today. So I would like to take the opportunity to host this webinar today. I am Niharika Sapra, KHA volunteer. I welcome our respected speakers, Chairman and CEO, Dr. Kavita ma'am, KHA volunteers, and all the attendees to KHA webinar. KHA Homeopathic Study Group Pro Bono was organized and founded by homeopath and humanitarian Dr. Kavita Kokono, President and CEO of Kavita Holistic Approach KHA. This study group is intended to be an offering from Dr. Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundation principles for KHA. KHA's mission and vision are very unique: to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches, and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita ma'am is a member of Kelvin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CHC, and Akina CPD provider, and serves as the associate editor for the Homeopathic Heritage. She is the recipient of Martha Oldman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Telugu Association of North America, TANA, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hand of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Chima, ex-director Homeopathy, Government of Uttarakhand, and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. I also welcome Dr. Deepak Sharma, KHA Executive, Dr. Rajneesh Sharma, KHA Advisor, and Dr. Shweta Singh, KHA Chief Administrator. KHA team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. We are extremely happy and proud that we celebrated 12 years of her book, Beyond the Limits, a challenge to prove oneself. And her second book, A Dose of Spirituality with Kavita, has also completed its 2 years. The ebook was launched last year in presence of honorable guest of speakers, American Institute of Homeopathy, President Dr. Alex Baker, and Council for Homeopathy, CHC President Dr. Sheetal Tiwari at our KA webinar. At KA's second annual celebration, our honorable guest, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities, which we have also listed on the website. Dr. Kavita donated the proceedings of the books through KA Study Group platform to various charitable organizations and homeopathic associations. To name a few are Kelvin Fenry Foundation, CHC, DHMA, JSPS College, VT Seva, NCH, etc. Interested ones can reach us for details at carstudygroup@gmail.com. As of now, we have nearly 400 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kokunu. This webinar is moderated by KA family, today by me. It is being recorded as we speak. We will take questions at the end of the webinar. And we will post a jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your participation certificates. And kindly mute yourself and turn off your videos for better connections. I would like to share the code of ethics. The ethics of KA Homeopathic Study Group Pro Bono. To be a KA speaker, one needs at least 1 to 2 months active volunteering. Only KA speakers' themes are promoted in newsletters and webinars. KA provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. Articles of volunteers will be posted on KA website and newsletter and will be sent for publications at other journals too. Volunteers and speakers are eligible for prestigious KA annual awards. Volunteers are eligible for KA inspirational talks. Volunteers are eligible for case discussions. KA promotes homeopathic organizations as well as their mega events. KA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. KA maintains a healthy and happy environment, so keeps only like-minded folks. KA requests everyone to maintain the confidentiality of the group. For further details, you can visit the website www.kavitakhomeo.com. Let me introduce our speakers to you. We have with us today Dr. Yashika Arora Malhotra and Dr. Manasvi M. Nikam. I welcome both the speakers at our platform today. The topic for today's webinar, Dr. Yashika will be speaking on the topic dealing with cases of migraine, and Dr. Manasvi on the topic strategies and approaches in treating critical diseases with homeopathy. To mention about our speaker, Dr. Manasvi is distinguished figure in the field of homeopathy, serving as Deputy Director at Aditya Homeopathic Hospital in Pune. She is devoted practitioner of classical homeopathy, carrying forward the legacy of her renowned father-in-law, the legendary homeopath, Dr. Amar Sinha Nikam. She has played a pivot role in treating numerous challenging cases with classical homeopathy, showcasing the effectiveness of this holistic approach to healthcare. Dr. Manasvi's commitment to excellence is reflected in her educational background, where she has consistently excelled, earning top honors in her academic pursuits. Her dedication to advancing in the field of homeopathy is further demonstrated through her contributions to the literary works of Dr. Nikam, including a significant role in the publication focusing on the book for treatment of acute cases, that is, a homeopathic guide to COVID-19. I welcome you, ma'am. Dr. Yashika Arora Malhotra, BHMS from NHMC Delhi, MD Homeopathy, DNHE from IGNO, Consultant Homeo in Live Homeopathic Clinic, Janakpuri, Delhi, achiever of STSH 2015-16 Scholarship Program by CCRH, admin of various homeopathic groups with a database of more than 20,000 doctors worldwide, editor of the Homeopathic Heritage and Homeopathy 360, organizing secretary, Dreams Innovative Homeopath, National General Secretary of All India Homeopathic Student and Youth Association, former president at Homeopathic Medical Association, Delhi, lifetime member of HMAI, IIHP, SDHA, IHMA, World Science Congress, Kolkata, speaker and organizer at numerous platforms, seminars, CMEs, webinars, camps on homeopathy for past 6 years and so on. We are glad to have you here, ma'am. I welcome you. I would request, firstly, Dr. Yashika ma'am to please proceed with her session. Dr. Yashika ma'am, you could unmute.
Yeah, thank you so much, Dr. Niharika. I just want to request you to kindly allow me to share the screen.
Yes, ma'am, I have made you the co-host.
Thank you so much.
Over to you, ma'am.
I hope my screen is visible to everyone.
Visible.
Yeah. So thank you so much, first of all, Niharika, for such a wonderful introduction. And I'm glad and I'm very proud to say that you've given us so beautiful starting, so beautiful beginning you've done for the very first time you've joined us as a host. So thank you so much for moderating our session. I'm lucky to have you here. And thank you, Kavita Holistic Approach, Kavita Kukunur ma'am, and Ka Study, Homeopathy Study Group, and all team members, our family, Ka family. Dr. Shweta ma'am, Dr. Poonam, Dr. Nupur, Dr. Shravani, everybody. Thank you so much for giving me this opportunity to share my views on once again on this platform. And it's today's topic for me is dealing with the cases of migraine. And my co-speaker, I welcome her along with me, Dr. Manasvi Nikam ma'am. I am glad again to have you here as well as chairing the session with you. So thank you so much, ma'am. This is a disclaimer. I would like, before I begin the session, I would like to display this disclaimer that all the webinars are for educational purposes only and not intended to diagnose or treat a disease. So I hope you can benefit with the information shared during the webinar as expressed by the speakers, moderators, as well as the attendees as a part of educational experience. And the presentation, the webinar do not necessarily represent the position of the Kavita Holistic Approach, Ka or Ka Homeopathic Study Group Pro Bono. So before beginning this session, I would like to discuss a short description or a short description about the migraine. As you all know, everybody knows that we have so many clinical cases which come to us every day about headache or or cluster headache or migraine or some or the other thing. we have lot many cases at our clinic when you express about headache or pain in head, or pain in head with nausea, pain in head with acidity, pain in head with vomiting, or pain in head with weakness or any other thing. So uh, migraine in all associate as a one-sided headache. Usually it appears as a one-sided headache. Maybe it's associated with nausea, maybe vomiting, maybe visual aura, or post-headache weakness. Normally, a headache is often not localized. If you say a normal pain in head is there, so which is not localized, like one-sided, or this is happening here, or over this side of the head, or this side of the head, and does not affect vision. There is no sensitivity to light or sound. Like the headache increases due to light or sunlight, or tube lights, or due to extreme sound, so, or extreme sense of smell. So it can be termed as normal headache. But when you talk about migraine, yes, it is a localized pain in head, and it may affect vision. It may be sensitive to light. It may be sensitive to sound, and it may cause nausea. It may have associated symptoms along. It's a neurological condition, and it may be present as a pain which is very severe, which is very throbbing or pulsating or pulsing, and usually it's present on one side of the head. And it may be accompanied with all these things like nausea, vomiting, and extreme sensitive to sound and light. And it may last from a few hours to a few days. We have different stages wherein migraine come up, and we have in this session we'll be discussing how a case come to you when it can be diagnosed as migraine, and how you can deal with such cases at your clinic, or when you are just taking a case of pain in head. So how do you proceed? So don't think as a prejudiced observer, first of all, that yes, if it's pain in head, one side of the head, so it is migraine. No, it is not. When you have a proper sequence which migraine comes up with, like there are stages which come up during the of migraine, which come up, like the first stage when you talk about migraine is prodrome stage, which may happen 1 or 2 days before the headache, before the pain. Like patient may complain of mood changes. Patient may complain of some food cravings or constipation or some stiffness, or there is frequent yawning, or there is retention of fluid, or there is some urinary problems, increased urination, you can say. So one or the other symptom, if you happen to see in your patient at clinic, that he said that 1 to 2 days before I have such things which happened, like I was constipated, or I had some mood swings or some other. When the stage of pain in head starts, it may start with an aura, or it may start without an aura. First of all, we are going to discuss it may be with an aura. So whenever a patient comes to you who has pain in head, or you can diagnose it as migraine with aura, so this aura may usually occur before or during the headache. So these are usually reversible changes which occur, which happen in the nervous system, and it may be like visual disturbances, or visual like this bright spots, or some flashes of light, or some dim vision, or blackness of vision, or blackness before eyes, vision loss, you can say, or some pins or needles sensation in any arm or legs. There may be weakness in the face. There may be numbness in the face or one side of the body. There may be some difficulty in the speaking. So this aura, if the patient is developing before headache, or during pain in head, during the episode of migraine, so you can judge it as migraine with aura. Without aura means there would be pain in head, one-sided headache, or it may be associated with some nausea or vomiting or acidity issues, or it may be aggravated with the sounds, or with exposure to light, etc. When this episode occurs with aura, this may be having visual symptoms, some visual symptoms, or some sensitivity like pins and needle sensation. And as soon as it reaches the attack stage, that is the headache stage, which may last from 4 hours to 72 hours, and usually it varies from person to person. The pain is usually on the one side of the head, maybe on the or both sides, but it is localized. It may be throbbing pain, it may be pulsating pain, it may be pulsing pain. Again, nausea and vomiting may be accompanying symptom. The post-drome stage, when patient comes to you with such things, like he may explain in history that this episode has occurred before as well. Before, like once after the attack, when I feel drained, I feel completely weak, confused, washed out. And some people may report that they feel elated, or they have some sudden head movements, which may bring on the pain briefly. Like some movements may bring on pain again or aggravate the pain. So in such cases, when you see a patient which present with such symptoms, so you should diagnose it as migraine. You can diagnose it migraine, and it may be the reason which you may get the cause behind the headache, the history, when you rule out the history of the patient, like how the headache starts usually, or what are the aggravating factors, or what is the etiology behind the headache. So it may be due to the bright light, severe heat exposure, or extreme weather, changes in the weather. Dehydration may be one of the cause, or changes in the barometric pressure. Hormonal changes may be one of the cause when you talk about migraine cases. Loud sounds, excessive stress history, or there is intensive physical activity, or somebody has skipped meals and there is gas acidity, or some change in sleep patterns, some unusual smells, certain foods, food aggravations, smoking, the history of smoking, the history of alcohol use, history of traveling, or history of using certain medications. Family history is one of the major factor, that yes, if your mother or father is suffering from recurrent episodes of migraine, so it may be one of the cause, it may be in the etiology once. Or when you talk about age group, so usually the adult this age, when the person is overwhelmed with lots of responsibilities of his life, and overburdened with family circumstances. So this is the peak during your 30s when migraine may occur. And usually women are more affected, three times more likely to affect than men. The diagnosis is already done, that you can go for this medical or family history, and then you can also rule out some other causes, like through CT or CT scan or MRI scan, if there is the cause, other cause, some hemorrhage or some tumor or some brain structure or issue with the brain structure, or some stroke history. So first of all, whenever such a case comes to you, you have to go for it as general management as well as homeopathic management. When you talk about a homeopathic physician, as a homeopath, you should go for general management as well as homeopathic management. General management usually includes, in cases of migraine, that you can use cold therapy, cold ice pack they can use on head, or just to relieve stress. They may adapt themselves to drink ginger tea or green tea. They may also go for massage therapy, or avoid food triggers like chocolates, ice creams, burgers, or something like which is junk outside food. And you should advise them that they should take more of magnesium, green vegetables, and mushrooms, etc. That would increase the body, increase magnesium ions inside the body, just to relieve them from recurrent episodes of headache. They may also go for acupressure, acupuncture, or drink coffee. But when you talk about homeopathy, so usually doctors advise to avoid strong coffee during homeopathic prescriptions. So it's an exceptional part. This is the general management. So we can discuss it further when if there are any queries. So why and how you can go for homeopathy in cases of migraine? When you deal with the case which comes to you with pain in head, chronic pain, chronic episodes of pain in head, and there is extreme pain which is not tolerable. So homeopathy is the only choice of treatment, because the other alternative types of treatment and other treatment therapies available are normally, like, you can take painkillers, you can take some of the other alternative rules. But when you talk about cure of migraine, the treatment of migraine, managing migraine properly and resulting it into cure, then you should go for homeopathy, because it actually is very highly effective, and it is safe with no bad effects. And it targets genetic factors as well as addresses chemical imbalance, treat the cause, as well as has a good success rate. So now we come to homeopathic management. But before we discuss the homeopathic management, we will discuss when a patient has come to you with the case of migraine, how you can deal with that patient, and what all medications you can think about when usually this such cases of migraine come to you. So I would like to discuss a case which came to me a few years back in the OPD. A 23 years old female reported to me on this very date in 2021 with the complaint of pain in left temporal region, and which was localized to forehead also, and right temporal region also, as well as occiput, which was radiating to sacrum. The pain was radiating to the back, to the sacrum. And the pain was, when the patient was asked how is the sensation of the pain which he is suffering from, so he said that it was a bursting and hammering sensation which was aggravated from sunrise to sunset, and it used to increase on exposure to light, sound, open air, or when there was absence of menses, or when she was suffering, if the case was of amenorrhea, if she had some episode of amenorrhea or absence of menses, so the aggravation aggravated, so the headache you used to aggravate. It was ameliorated from cold water and putting ice overhead, green tea, or enclosed rooms. It was associated with burning in both eyes, sorry, and watery discharge from eyes. The patient also complained of hair fall since a few months. The reason was not associated with headache or somewhat, but it was another complaint of the patient. When taking the history, the patient was there. It was ruled out that the patient had ovarian cyst 3 years back, for which she took homeopathic medicine. And the mother told the history of migraine, that there was a genetic history. She also used to suffer from episodes of migraine. Further case taking, as you all know, that you have to go for physical journals and mental journals. So patient was patient was asked about the journals. So she said that she was aggravated to extremes of weather, either too hot or too chill, and had a bad craving for spicy and sour things. She was thirsty and very she used to be thirsty. The thirst was increased with dryness of throat, and used to take water sip by sip. The perspiration, the sweat was increased over face and chest and abdomen. And she had dreams of fear of snakes, actually. So her sleep was very disturbed. She used to dream if she wandered from here and there, or she had a extreme fear of snakes. Further taking out the mentals, further taking out the mentals, she imagined that she used to imagine snakes everywhere since 1 year, with some fear of with some fear of snakes. In the history, I asked her about, yes, if she had some coincidence or some incidents with the snakes, or presence of any snake, or any of the family species of snake. So she said no such episode was there, but only since a year she used to imagine snakes everywhere. Not such any mental history she used to explain with this marked reason. Her anger increased usually when things did not happen according to her mood. She had a history, she had a complaint and a journal of suppressed anger with aggravation when she was consolated. She used to weep all alone and always desired to be alone. Her hobbies included reading, writing, music, etc. The patient was there is usually a migraine scale which is being used to measure the intensity of headache, to measure the impact of headache on a person's life. So this migraine disability assessment questionnaire, MIDAS questionnaire, was being used for this for ruling out what is the impact of migraine or headache on the patient. Usually this MIDAS questionnaire explains the impact of headaches on your life, and the information or the questions which are being asked, that include on how many days in the last 3 months did you miss work or school. Like, is it hampering your work life or your school life, and how many days you have bad productivity or something school reduced because of your headache, or on how many days you couldn't manage your household work, or how many days the household work was reduced, how many days you miss family activities, social activities, leisure activities because of your headache. So these are questions are included, and it rules out what is the impact of a Midas of migraine over a patient. So if the score usually occurs uh, between 0 to 5, so it is usually first grade and mild, you can say, with little or no disability. When the score is from 6 to 10, there is, you can term it as mild disability. When the score is 11 to 20, it is termed as moderate disability. And when the score is termed as 25 plus, so it is usually severe disability questionnaire. So, when you discuss such a case of migraine in at your clinic, so you usually put down totality and note the marked symptoms. Like, you can, if you talk about such case, so you can include imagine snakes everywhere, used to weep alone, used to desire to be alone, thirsty, dryness of throat, sleep disturbed, desire for lemonade, pain in left region, and it radiated to sacrum, pain aggravated from light, sound and open air, burning in eyes, pain and molleration from cold water or putting icy cold. So all these symptoms were included, and the patient was analyzed and symptoms were evaluated as per the homeopathic laws, and as we usually do a normal case taking and analysis of evaluation of symptoms. The miasm obviously showed it as more towards the sora, because the level of disturbance in the body was at a functional level, and the symptoms all of obviously were deviated towards sora. So when you rule out with such cases, there may be more symptoms. We'll be coming back to this case. We'll be coming back to this case after discussing about a few remedies and a few symptoms, other symptoms which can come up with the cases of with the cases of pain in head, and what all remedies you can think about when you have some such patient at your clinic. So we already noted this case and how we can go with this case, or how we can come out with the journals, etc., and how we can evaluate the case. Now we come on different remedies which we can think of when any of the patient of head, though there are numerous remedies, I would say. So there are number of remedies which come up when you talk about pain in head. It may be from belladonna to magphos to arnica to aconite to rustox to hypericum to any to dulcimium to glonine to natramure. Many of the remedies come up in our minds when you talk about headache. The cause may be anything, and the diagnosis may be migraine. So we'll be discussing a few remedies and a few marked symptoms of commonly used remedies, though there are a number of remedies which can be used, rare remedies as well as lesser known remedies are also there, which come up in various cases of migraine so beautifully and give miraculous cure. So we'll proceed with few medicines, like belladonna is one of the common remedy which is being used when you complain of pain in head, which may be worse with light, noise, jar, or better by poke pressure. But when you talk about headache, it is worse on right side, or when lying down, or due to ill effect of cold after having haircut. And the patient mania can be taken into consideration when you talk about belladonna, stramonium, hyoscyamus, like the patient, how he's behaving, how he's violent, if he's violent, or there is some striking mental journal when you get, if you get about while discussing the patient of belladonna. So there are symptoms which may be present. Another remedy which we can think of is brinium, which may present as heavy splitting headache with steady pain, maybe due to changes in weather, especially the which if it settles over one eye. Sorry, I have written it wrong. I think it is actually a right-sided remedy. So when the pain settles over right side and spreads to the entire head, it is worse from any type of motion and moderated by rest. In nausea or vomiting may be one of the feeling, the heavy feeling, bloating in the stomach may be a marked symptom of a brainia patient. Ignatia is also one of the remedy, like we can discuss Ignatia and Natramure beautifully. They coincide, and they can be compared. Like if there is migraine in sensitive people, usually after emotional upset or grief or an acute grief episode, and the pain is radiated to one side of the head, as if the nail is driven off. As if the nail is driven off. So you may think of ignatia. The patient usually yawns. He may have a yawning or sighing in the prodrome stage of the episode. They may weep or they may be hysterical. Iris versicolor, again a beautiful remedy for migraine, which is associated with blurry vision, which is associated with aura, and extends to the teeth with vomiting, maybe burning feeling in the throat and stomach. Iris is a beautiful remedy which is very, 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 very effective in cases of migraine. Natramure, again, compared to ignatia, acute grief, natramure goes for long chronic grief, emotional upset, or too much exposure to sun, or it may occur from before and after the menstrual period. The patient complains. The marked feature of natramure is the patient complains and feels like 1,000 hammers were knocking on the brain, like 1,000 around. Patient बोलेगा कि ऐसा लग रहा है जैसे कोई हथौड़ा मार रहा है मेरे continuously, or due to eye strain. Natramure may be one of the good remedies. Nux vomica is a wonderful remedy. It is always advisable to say, to tell everybody that you should, or as per Master Hahnemann's guidelines, that you should not have favorite remedies, or you should not be biased towards one or two or the remedies. But usually it is one of the good polycrest and very commonly used polycrest by maximum homeopaths, the remedy Nux vomica. which covers migraine beautifully with vertigo, and the brain feels turning in a circle. Oversensitiveness may be there, loss of consciousness may be there, frontal headache with desire to press the head against something, like somebody pressing the head over the wall or somewhere. So congestive headache, or the patient feel distended, usually after a debauch or after alcohol or after smoking. Usually bad effects of alcohol or smoking also is covered by nux vomica. When a patient of right-sided headache comes to you, the first and foremost remedy which comes into mind is, like, if you talk about me, so it comes to me like sanguinaria is one of the good remedies. Silesia is also a good remedy. Briny also you can think of. But yes, when it's American sick headache, in over the one side, that is the right side of the remedy, with some tension in the neck or shoulder, and the headache usually improves after the patient vomits, so or passing gas or after sleeps. So this is a beautiful remedy which comes into mind and is very effective. Sancan, wonderful remedy for migraine. Sepia again in maximum used in females for a left-sided headache, when the patient has some marked features about the lifestyle. Also, if you talk about mental journals, the patient is very weak, having a weeping tendency. She may weep in front of you only, and also may tell about indifference which has come in her nature for their own loved ones or family members. Left-sided migraine with vertigo, dizziness, nausea, worse after missing meals, usually respond to such remedy. Silesia again, I talked about, very beautiful remedy for right-sided headache, especially if the pain is starting from the back, extending to the forehead and settles over this eye. So yes, you have to take care when you talk about the presentation of this headache. So if your patient is coming to you and says that he has a headache which starts from the occiput region or the neck region and it comes over the forehead's extreme headache and it settles over the right eyebrow, over the right eye, you may think of Silesia as well. Spigelia, again, a beautiful remedy for left-sided headache. Sepia, left side. Spigelia, left side. Sancan, Silesia, Bryonia, right side remedy. Spigelia, when you talk about it, is a very beautiful remedy for violent throbbing, stitching pain, prospalgia, facial neuralgia. Patient is worse from motion. They may explain with pain in the whole face, and usually better lying on the right side. Simicifuga, again, Simicifuga resmosa is a beautiful remedy. Coffea cruda is a great remedy when you talk about headache and sleeplessness with agitation, overactivity of mind. Then coffea comes into picture. Simicifuga Simicifuga for migraine with throbbing pains, as if the top of the head would open. It would open, or there is shooting pains in the eyes. It may be associated with the menstrual nices, or it may come up with the after a long-term study or after long-term history of worry. So usually the patient feels so stiff and painful. The person who is very mentally talkative, mentally active, energetic, he or she may feel very dull and gloomy when you talk about simicifuga. Glonoine, again, a beautiful remedy with hypertension. If there is high BP, one may think of with headache, with migraine episode, Glonoine, Lachesis, Belladonna. These are the remedies which which comes into our mind when you talk about hypertension, or there is sensation of fullness in head. There is heat. There is feeling of heat which is aggravated by heat or haircut, etc. So Glonoine will be one of the remedies. Cyclamen again is one of the remedy with aura. Migraine with aura, when you talk about, especially in females, when it's associated with disturbed menses as well. Often right-sided remedy involving itch or dim vision or nausea, etc. The cyclamen can be think of. thought of. Lachesis gelsemium. Gelsemium, though, no doubt, is a great remedy, which is very helpful with headache, with fever, migraine cases, and the headache around the eyes. Undoubtedly a good remedy, a beautiful remedy. Lachesis for left-sided migraines. Remember, left-sided migraine was pygelia. Left-sided migraine was this sepia, spigelia, etc. And then we come to this lachesis, left-sided migraine with congested headache, which is worse from pressure or tight clothing. Headache which is worst before the menstrual period or from sleep, you can think of lachesis. Now we come back to the case. I hope you have a little idea about few of the remedies which can be used during this during cases of migraine when they come to you. You can think of any of the rare or lesser known remedy. It would act beautiful. It would act great. It would show miraculous cure because yes, homeopathy actually is a miraculous science. Now, coming back to the case, we had the Midas score was 4th grade, and the totality which was made was this. We already discussed. I hope everybody is with me. The remedy which was chosen, we'll be coming to that again after this slide. So the totality which brought us to few of the common symptoms, few of the symptoms like one-sided headache, which was better in room, aggravated in open air. She had a weeping tendency with desire to be alone and desire for lemonade, bathing, pain in left temples, prolonged migraine, recurrent episodes of migraine, desire to be alone, pain in temple and forehead region with dryness in throat. So all these symptoms were taken into the totality, and the remedy which was prescribed was cyclamen europium 30 OD for 3 days. Yes, it's one of the commonly used remedies for headache, especially in females. So yes, this remedy was chosen, and after totality of after this prescription, patient was followed after 3 days. Patient was followed up with with sacrum lactis 30, which was prescribed thrice a day for 1 month on 16th of August. And the Midas grade was 4 with showing severe disability score. There was initial improvement in intensity and duration of pain, but after some time, the patient had recurrent episodes again, which was increased after a month prescription. So on 18th of August, cyclamen 200 once a day was prescribed consecutively for 3 days, followed by sacrum lactis for another 1 month. The patient came back with wonderful improvement, and in a month she had only 2 episodes of migraine during the whole month, and now she was examined with the Midas Midas question score. So it came out to be grade 3, not grade 1. On the third visit of the patient, it was grade 3. So patient was again asked what are the symptoms, what is she suffering from. The totality was being made, and the totality again was signifying cyclamen because there was no much changes in the episode. Only the recurrence was decreased. So the patient was prescribed again cyclamen 200 consecutively for 3 days after 2 months, followed by sacrum lactis for 1 month. And she was followed on sacrum lactis for consecutively till 1st of December, when she came to me and said that she was feeling much better and there was no episode of migraine since the past month. And she was feeling much positive and much better. So the Midas score was analyzed, and the grade was 1 that time, with very mid severity, low, very light severity. You can see this 0 to 5 score with little or no disability. The prescribed medicine not only improved her symptomology, but also improved her general condition, positiveness in life, as well as improvement in her nature, and she was positive towards life. She's still one of my good patient which come up and shows her whole family shows to me. She's still under my touch, and she's still in my touch, and we have it is very less that she suffer once in a year, or once or twice in a year with headache, not actually episode of migraine. So yes, there was no medicine continued, but yes, she was being in touch, obviously, if there is an episode which occurs. So I hope I could give something you could take away from this session, and I could teach you something, that how to deal with cases of migraine by discussing such a case. We can discuss further in future webinars. But I hope for this part today, I'm done. Thank you so much. Thank you, Ka. And I would like to request Dr. Niharika to please take the session from now, and also welcome my co-speaker with us. Over to you, Niharika.
Thank you, ma'am. Thank you for the beautiful, insightful session. Now, moving forward to Dr. Manasvi Nikam, ma'am, I would request her to take up her session on strategies and approaches in treating critical diseases with homeopathy. Dr. Manasvi, ma'am. Ma'am, please unmute yourself.
You're not audible.
Yes. Am I audible now?
Yes, audible.
Yeah. So thank you for a good introduction, Dr. Niharika and Dr. Yashika ma'am, for a beautiful session on migraine and a very good case with a good explanation. And thank you, Ka Group, for inviting me on this platform where there is a good discussion about homeopathy, and especially Dr. Kavita Kuknur ma'am, who is such an enthusiast. And of course, after hearing so much about her work around the globe and humanitarian work which she is doing, so really she is an inspiration for women homeopaths in India. I'm very glad to share this platform with my co-speaker, Dr. Yashika ma'am. And now, as I think we have extended with the time, so we'll start the session soon. And for other speakers, I would like to have an interactive session. So you can just ping me after the session is over, and we can have a good discussion on it. So about today's topic, as today's topic is strategies and how to heal the critical cases with homeopathy. So I'll start the session. So is my screen visible?
Yes, ma'am, visible.
Yeah. So this is a disclaimer by Ka group. So this all the Ka homeopathy study group webinars are for educational purposes and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinions expressed by the speakers, moderators, and attendees are the part of educational experience and do not necessarily represent any position of Ka or homeopathy study group. Okay, so this is mandatory to read. So I had just quick reading on it. So first, I would just give a short brief about me for 2 minutes, which is that I work at Aditya Homeopathic Hospital and Healing Center, which is situated in Pune, and which is the homeopathic 100-bedded homeopathic hospital, which solely runs on homeopathic treatment for many critical illness and has magical results on the patients. So it is founded by legendary homeopath Dr. Amar Sinha Nikam sir, who is my father-in-law, and he is a very well-known homeopath in India, and he has many achievements under his head for treating many chronic and some very difficult cases throughout his lifetime journey. And we are now working under his guidance in this hospital. So this is our hospital, which is in Pune. So this is the overview of the hospital. Unlike any other conventional medicine hospital, this hospital is a representation that homeopathy is no less than any other medicine, and homeopathy can heal every kind of disease. So this is Dr. Amar Sinha Nikam sir. This is Dr. Suchitra, Dr. Manish Nikam. This is myself, Dr. Manasvi Nikam. We as a team work in this hospital. So these are the patients hospitalized. So these patients are given only and only homeopathic treatment, even for the cardiac cases, and are monitored by the team. So these are the facilities what we provide. So there is a OPD facility 24-hour, a IPD facility, a well-equipped care unit, latest diagnostic tools and machinery, internship programs, homeopathic camps. Then this hospital was inaugurated by the Chief Minister of Maharashtra. I'll be sharing a quick short video.
One man dared to be wise, and it never. And hearken a deeply bad. The rays of the morning sun bathe his endeavor in glowing sunshine. Hospital here, hospital in a day. It took one very determined man 4 decades of absolute dedication and intense medical prowess. He is a man on a mission. He is Dr. Amar Sinha Nikam. Dr. Amar Sinha spent his early years researching and practicing the classical form of homeopathy in the neighboring villages of Pimpri. But what prompted this man to build such an institution? When I completed my college, I was not happy with the homeopathic consulting practice. At that time, I felt people are suffering very badly. They go for surgery, they go for expensive medicine, bypass, so many critical surgery. And the expenditure was very aggressive. So, this was the pain of society. He shared his dream of building Asia's first private homeopathic hospital with his father. With his support and the courage to face every challenge, Dr. Nikam started a 4-bedded hospital in Pimpri on the fateful day of 2nd May 1995. This was the old hospital building which grew steadily. And now, the new hospital is the fruit of his tireless work over 2 decades, dedicating his life to homeopathy. Take a look at this 7-story building. Separate general wards for male and female patients on the 2nd floor of the hospital. Also has 2 separate state-of-the-art ICUs. All of these services are provided at affordable rates compared to any other private hospital. From 3rd to 5th floor,
Is my screen visible?
Previously it was visible, now it is not.
Is it visible right now?
Oh, no, no.
Uh,
one man dared to be wise and an endeavor.
is it visible right now?
That
No,
how
ma'am, it is not.
Yeah, some of
the
this I'm
rays of
getting
morning
visible.
sun
now.
bathe his endeavor in glowing sunshine. On energy. It took one very determined man, 4 decades of absolute dedication and intense medical prowess. He is a man on a mission. He is Dr. Nikam. Dr. Amasya spent his early years researching and practicing the classical form of homeopathy in the neighboring villages of Pimpri. But
Ma'am, your screen is not visible.
Let me check what's the issue.
You could reshare it, stop sharing and then reshare it.
I'll do that. Is it visible now? Because I'm getting it's
No, not visible. Ma'am, if you could try to reshare it.
yeah. I guess it's visible now.
No, ma'am, it's not visible. Yes, now it is visible. Yes.
Yeah, because
Now
it's
it is
shown.
visible.
Yeah. Yeah, we are there, right?
Yes, ma'am, you may continue.
Okay. Okay, so we'll directly begin with the today's topic, that is strategies and approaches in treating the critical diseases with homeopathy. So basically today I'm going to talk on harnessing the power of homeopathy for challenging conditions. So understanding exactly what critical cases means. So critical cases, which means the cases which are difficultly handled under any treatment, especially under conventional medicine of treatment also. So example of such challenging cases is like the cancer cases, cardiac cases, AIDS cases, autoimmune disorders, and many more. Even though these cases are challenging for any form of treatment, but homeopathy has a significant role to play in it. Why? Because homeopathic medicine, as we know, it acts at the cellular level, and any diseases, especially critical disorders like cancer or AIDS or autoimmune disorders, they have deep rooted causes and disturbances or injuries at the cellular mechanism. So, here the very important role which the medicine plays is the homeopathic medicine. Homeopathy, as we know, the holistic approach, as the holistic approach is a key to homeopathy, because even though now there are many kind of practices done in homeopathy, but this holistic approach, it's a key, or it's a basic classical homeopathy which Dr. Hahnemann introduced. So holistic approach, what it means, it actually means what, it actually means addressing the root cause of disease. So it's not treating the disease itself, but the whole person, the whole entity, the whole energy which is deranged. So this is a individualized treatment, and especially we consider here the peculiar or the characteristic symptoms. So this is a basic introduction. Even though like there are some specific formats of treating, which we'll be discussing it further, like some diseases or some treatment methods of treatments now have removed the protocols. The protocols, what they actually mean is they have the specific kind of medicines which treat the specific diseases. So what we practice at this hospital, where we are seeing these critical cases on daily basis, hundreds of cases, here we just practice this simple Hahnemann method. Here we don't have any kind of fixed protocols or a fixed baseline to treat patient. So I had a short introduction about this because we solely believe that holistic treatment, what is the essence of homeopathy, that lies in the holistic treatment. So what we exactly do here, so critical cases strategy, what is the strategy? That is, we have a proper case taking format. So there is no shortcut in case taking. right? So as I said you, there is no specific remedies we look up to for a disease. Like a diagnosis doesn't have a specific remedy or a shortcut to a remedy. So we follow a genuine way of treating these diseases. That is, we have a thorough case taking, which we inquire about his uh, general the symptoms of the patients, and then about his physical condition, about his pathological condition, and about his emotional state. And from this, the main idea is to generate the causative factor of the disease. And after that, the main thing which we focus on is the PQRS symptom, or in order to understand the pathology and correlation of that pathology to the presentation of disease. And though the significance of seeing all this is that we have to study the miasmatic background of the patient. Miasmatic background is necessary because we have to know the approach, exactly what kind of approach or what kind of medicines should the patient get. So understanding the idea behind treating the critical cases is that we should be able to maintain the format or simplicity of the science, that the individualization should be performed at every level. When you look into the critical cases, example, the critical case of cancer, any kind of cancer, or a critical case of kidney or a heart, so you find a similar set of symptoms, right? If it is a cardiac case, we find breathlessness, chest pain, or similar symptoms. So our focus is not looking into this common pattern of the symptoms, but after investigating thoroughly, the idea behind this is that we try and find some uncommon or some strange symptoms which patients show. The strange symptoms, what exactly they mean, I mean to say, they mean that the strange symptoms, how the breathlessness is exactly aggravated or ameliorated. So common aggravations, motion aggravation. So this is a common aggravation any cardiac patient may show. Okay, so this is not to be considered of utmost value. So we look for some uncommon, some very rare, where we get the patient is better on some position or side. Patient is better by some particular situation, that is some particular scenario, some particular weather. So these are all characteristics of the patient. So we try and find those characteristics. So these are the key to prescription. So these keys will ultimately lead to a remedy which will give you a magical result, what we call that is a result in short time. So where critical cases, it is very necessary that you can't take much longer time to treat a patient. It is very much necessity of a patient because he is in severe condition. So it is very much necessary that we should be able to judge the patient or give the result in very short time. And so as you can see on the screen, so this is all we need to consider. So this is the physiology of patient. So physiology, what it exactly means, that the normal desire, aversions, thirst, bowel, urine. So this is a physiology of human body. So that needs to be considered. If it is altered or not altered, so that needs to be looked up. Other thing is the pathology. So pathology, so many of the homeopathic remedies, as you know, their action is on the certain kind of pathologies. Like some remedies act on the inflammatory pathologies. Some medicines are good at the degeneration pathologies. Some set of medicines like aconite, okay, belladonna. So they are basically good acting on the inflammatory pathologies. So they work good in acute conditions. So on other hand, the medicines like Kali group of medicines or Auramate, they work good on the degenerative pathologies. So we need to consider the pathology of the any patient or the disease, so we can correlate it directly to the prescription. But the idea behind this is that the remedy which we are giving should balance equally all the criterias. So one should not only prescribe on the pathology. So you can't be giving a medicine or a med to every cardiac case. So this won't give results, or this is not the way what a classical homeopathy means. So other thing is that mind, and the mind, as you know, mental, emotional stress, elementary factor or the causative factor, which is very important factor to be considered while we are giving the homeopathic remedies. And the other thing is the clinical observations. So clinical observations, what exactly they mean for a homeopath? So for a homeopath, the clinical observations means that as the allopath, as they look up to the clinical observation as example of some liver disorder, so they look in the ascites, or they look for the some signs of liver disorders, okay, like Turner sign or the sign. So these are of utmost important to a homeopath also, because we have a particular rubrics in our repertories which cover this kind of remedies. So it is very much necessary to clinically observe the patient. So almost all the times, the clinical observation is overlooked by the homeopaths, because we often give less importance to the diagnosis of the patient. We consider patient as a whole. As a classical science, it is considered that diagnosis is not important for a homeopath. But in case it is not the idea, the clinical observation is equally important as like an allopath or as like a conventional medicine treatment. The clinical observations play a vital role because they never lie to you. Okay, clinical observations are the things which patient is clearly exhibiting or patient is showing you. So you should be very clear while observing those, like the some positional modality. If the patient is having pain and the patient is moving about in certain way, like he's leaning and sitting, or he is walking very slowly, he's putting his steps very slowly. So this kind of observation on clinical basis are very important, because they are most of the time unnoticed by the patient, because they don't have the idea of importance of these key points. So these key points, or the which we can say the clinical observations or the body language, or you can term it in other way, the body language, when it is medically visualized as a clinical symptom of the disease, it becomes the clinical observation. So you should always look for such observation. Then other part is thermal. So we have a very much important criteria, that is thermals. The thermal is important. So there is a very good research by Dr. Amartya Nikam sir on thermal. Uh, how he considers the thermals of medicines, how he considers the thermal of every patient and its correlation while giving the prescription. So it is mentioned in his thermals book. We can discuss in details about it later. But thermals, basically, it is very important to take. So after all this data, the information we get about PQRS is the core of our case. So here are some ways homeopathic medicines are prescribed. So as today's topic is on strategies of prescription in critical cases, so we'll be discussing in short the prescription, how it is prescribed in critical cases according to homeopathy. So efficacy studies, which what they mean is the clinical trials evaluate the effectiveness of the homeopathic medicines in the various conditions. By analyzing the results of these studies, we can identify the remedies which have promise in treating specific symptoms or diseases. So this basically means that many of the clinical trials, like similar kind of remedies cure similar type of condition in the patient, or they have specific actions. So it is very important to know this knowledge, so we can right time prescribe that remedy as a intercurrent remedy or as a beginner remedy of the case. So this data is important. The analyzing data is important. The second part is that comparative studies. So comparative studies is that research comparing different kind of homeopathic remedies with the conventional treatment provides the efficacy of different approaches. This information can guide us in selecting the appropriate remedy. So basically this what it means is, example, if we are treating a case of a diabetes case or a very high sugar case, so you should be able to compare the doses of insulin with the medicines which we are giving. So we have always seen in the hospital that even our medicines are so potent that they are able to reduce the sugar levels drastically in the patient. So you should comparatively have idea about the insulin level that patient is taking or has the history of taking insulin levels. So you should be able to compare those and able to prescribe in such manner. So other is PROMs, that is patient research outcome. So observational studies and patient reported outcome measures can provide valuable information about the real world effectiveness. What this real world effectiveness of the clinical medicine or clinical practice, what it means that some remedies, the materia medica on some remedies, as it was proven years back, has a limited data, and we have sometimes clinically find out the record that certain kind of remedies treat certain kind of patients or diseases very effectively. So this data is very important while prescribing. So protocol-based prescribing, as I mentioned. So some clinical trials have been taken. So you must have heard about the protocols. They have for a protocol for cancers, for rheumatic arthritis, and whatnot. But we solely we don't believe in such protocols because we have an idea that Dr. Hahnemann always gave importance to individualization. So protocols are lacking this essence of individualization. So we believe that remedy and dose or should be individualized, even if the similar set of uh, diseases or similar kind of pathology is present. So clinical judgment and individualized assessment remains crucial importance in homeopathic practice. So what this sentence exactly means that the clinical judgment is very important to treat the critical cases, and it is very crucial to study to treat the to practice homeopathy effectively. So so I have a question maybe. We can answer it at the end. But yes, in short, yes, thermal is important in surgical and acute diseases also. Why it is important, we can discuss at the end. But yes, it's very important. Um, So clinical case studies. So now, as we are time bound, so we'll have a short case, which is a case of a boy with acute kidney injury. So okay, so this was a case which came to me before 2 years. So this kind of cases, usually homeopaths hesitate taking such kind of cases, but I being observant and inspired by Dr. Nikam, who sees every day number of acute and chronic kidney cases and cardiac cases and whatnot. So I was always encouraged and inspired by him, that I took up this case. When they approached me, I never hesitated. I was very confident because of the inspiration and observation what I had on daily basis. So this was a case of a 12-year boy who visited with his father for complaints of abdominal pain, weakness, and he had history of severe abdominal pain, vomiting, fluctuation in the pressure levels, and episodes of hematuria and decreased urine output. So they already had visited the government hospital where the nephrologist had diagnosed it as the acute kidney injury. After undergoing certain tests, but the child was at no relief. After even giving analgesics, the child complained of abdominal pain and severe appetite loss, nausea, vomiting, and so the nephrologist had advised them dialysis if the situation remains status quo. So as we already know, the acute kidney injury, what it exactly means in short is that there is a decreased blood flow or oxygen flow to the kidney. So children, especially at the toddler ages, they suffer through these diseases. There are many factors which cause this. That can be infections, some streptococcal infection if they are untreated, or maybe some intrinsic factors like autoimmune or other toxins. So there are number of factors which can lead to this disease. But such children, they need to be lifelong monitored. If they undergo conventional treatment and if they have some dialysis done, so they need to be timely checked for their pressure levels. They need to be urine analysis test should be done, and other whatnot things, they should be completely restricted from the normal diet. So this predominantly happens in 3 to 12 age, and it is related to the episodes of nephrotic syndrome or nephrosclerosis, hyperlipidemia. So this basically, once the child goes through this disease, lifelong threat of many complications. They can land into the chronic kidney failures, or they can land into some cardiac emergencies because of the kidney output fluctuations and the pressure fluctuations in their blood. So clinical features of this are that it is used to refer the several kidney disease characterized by inflammation either in glomeruli or of small blood vessels of kidney. But not all the diseases necessarily have the inflammatory component. Glomerulonephritis condition involves the damage and inflammation to glomeruli. So now they had some basic investigations done where his HB was 9.3, WPC count was, as you can see on the screen, 19,600, RBC 3.3, and PCV 29.8%. So usually in these cases, there is more focus on the urine creatinine level in the children. So as we see in chronic cases, we give more importance to the blood creatinine levels. But in children, we usually judge by the loss of the protein in the urine. Especially spot urine protein here in this child was very high. It was 385 milligram per dl. Spot urine creatine was 33.2 and spot protein creatinine ratio was 5.81, which was a very high level of loss of proteins. And the biopsy, which was 3 plus positive coarsely granular diffuse mesangial and focal deposits along the basement membrane. Complement mediated MPGN pattern, CWC3 glomerulonephropathy. The possibilities are C3 glomerulonephritis and dense deposit disease. Immunoturbimetry is more than 0.3 gram per L. So this was about the investigation part. The child was suffering with the kidney injury, and he had much pathology on his kidneys, as the inflammatory stage already had crossed, and there was a mesangial deposits, as we gone through the biopsy reports. Now, as I told you, he came with the complaints of abdominal pain now. His abdominal pain was actually around the site of umbilicus, and which was sudden. And usually it was in the morning, and when he used to, when he was rising on after, so he had the pain, and followed by a episode of vomiting, which was watery and bitter in taste. So morning he used to have this pain and watery vomiting. And after that, he used to start with the headache, which was frontal headache, and which usually was pulsating type of headache, and pain in the lower extremities, fullness, tenderness all over the abdomen. This complaints usually is aggravated in morning, and he was better by lying down on left side. So, okay, so his past history was that he was uh, normal, full-term normal delivery child. All his milestones were normal. Vaccination was done. He had a history of head injury when he was very young. So now physical generals. He had habit of boring his fingers in nose and ears. Diet, mixed diet, appetite first initially was normal. He could not tolerate hunger, but now because of vomiting, he was not having enough food. So desire for spicy fruits and salted chips, aversion to sweet. Thirst was now, as they said, normal, but his water intake was restricted as he was diagnosed AKI. Head, as in complaints, he had a pulsating type of headache, especially in morning, and it was better by pressure. Perspiration, scanty on neck, hot sweating, especially sweating when he was eating. Sweating while eating, perspiration eating while was the symptom in him. Sleep time for 8 hours, refreshing sleep, lies usually on sides, left or right, covering up to head. Thermally, he was hot. So this boy was a school-going boy. He was a student. He had a stage fear. So reaction of jesting, that he was happy. He was angry when someone criticized him. He was very emotionally sensitive boy. Religious. He was very neat and clean. He was fastidious in his work. His interested subject was maths and difficult subject was science. Family, he lived in a joint family. The family condition was poor. The child was pampered. As he was very oversensitive, he expressed his anger only by crying. He was very less talkative. Hobbies, he liked dancing. He was very much close to his grandmother. He lived most of the time with his grandmother, as he mentioned in the history. He had fear of dark, ghosts, and animals. He likes traveling, cricket. So domination by father, fear of father, as father used to have quarrels with grandfather. So most of the time he stayed with his grandmother. He doesn't like this situation of quarrels at the home. So he usually gets close to his grandmother, and he has very few friends at school. So this was a idea about the case. So this is a case in which you could see uh, this little boy, 12-year boy, he's having he's diagnosed with the kidney disease, and as I told you, the physical generals, thermally he's hot, and mentally he's a sensitive kind of person, and he doesn't like quarrels in the family. He's very close to his grandmother. He fears of father, as the father quarrels with his grandfather, so he has fear about his father, and he's a very shy, sensitive kind of guy. So he has very few friends at the school, and so it's the case. So the response I'll read out for you. So response that we usually what we do here, while treating the critical cases also, we give the medicine, single medicine at a time. So there is no two medicines, or there is no over repetition of medicine. So we give a single medicine, single dose, and we do it very give a very simple medicine that is in 30 potency. So on same day, after single dose of remedy in of a 30 potency, the child felt relief in abdominal pain. And next day, he did not have vomiting, headache. Gradually felt more energetic and cheerful. Okay, so on the same day when the remedy was given, he was very much relieved with the abdominal pain first. Consequently, after the days, he was better with vomiting and headache. Then, after almost 10 days, the routine investigation reports were carried out, which showed his urine protein levels. So there was a marked difference in loss of his protein. So BP levels were recorded and that were normal. And now the nephrologist even was shocked that he doesn't have need of any dialysis. We can continue with the medicines. So so this was the thing. As you know, the kidneys, they are self repairing, or the nephrons, if in time, if we give a proper remedy, the kidneys are self repairing. So the medicine, homeopathic medicine, is of very much importance if it is given with proper knowledge. We can limit the complications of disease, and even we can stop the progress in the acute phase only. And so the child didn't need a dialysis till the date. So I'll be so this is a boy. So as you can see, you can observe him. I have mentioned some things about him, that like he's a lean, thin, dark, sensitive kind of a child. You can see a religious mark on his forehead, in his hands. So he's a kind of very simple person. And there is a video. There is a video where the child is.
आज काय काय होते तुला हा आणि
So can you see the videos? Can someone help me with this? Can you see the videos?
मग आता त्रास कसे आहेत?
No.
औषध घेतल्यानंतर कसं वाटतंय? मध्ये काही परत त्रास झाला का? एकदाही पोटात नाही दुखलं? बाकी लघवीला कसं होतंय? काही
Ma'am,
त्रास
the
होतो?
video is not visible. We can hear it, but it is not visible.
Oh,
काय काय त्रास होते याच्या आधी?
can you see the video now?
No, ma'am. The reports are visible.
Okay, so basically, I'll show the video. So we will first go through the reports. I'll show the video at the end again. Uh, so the video is in regional language. The child was explaining that he didn't have a episode of stomachache after he has taken the medicines. The medicine, it was given in 30 potency as a single dose, and sacrum lactis for the 6 times throughout a day. And so this medicine was given for almost 8 days, and the child has come with no abdominal pain, and little like 1 or 2 episodes of headache, and he have increased appetite. He feels more energy, and as you could see in the picture, he looks much more fresh. Like, I don't have the first picture when he had come to me, but this was the follow-up picture and a video where he looks very much energetic and fresh. So these are his reports. So you can see the reports, right?
Yes, visible.
So, as the urine protein, it was mentioned at the beginning. So, this was almost 335. So, this has drastically reduced. As you can see the levels, the creatinine has become 113 and 0.61 protein creatinine ratio. So, this is not still in the normal category. Like, urine protein should be more like 1 to 14, but it's 52. But priorly it was about 200. So 52 in 10 days, it's a very good achievement with homeopathic treatment. And after consecutive treatments now, he drastically showed that his protein loss had been stopped, and the child was free from all the he didn't have any kind of symptoms or the sufferings which he had before. And for the important thing, that the complications which he was prone to, like he would land up in some chronic disorder or a cardiac disorder because of the fluctuating pressure levels. So that was helped because of our remedy. So what is the miasm in this case? So you can just mention in the chat boxes. You can just text me what is the miasm of this case as we discuss this case. And if some participants are interested, they can just guess the remedy, and they can send the totality, what should be considered in this case. Yeah, you can just give some of your ideas and opinions in the and it's always that the remedies are not of much importance when we are discussing such cases. Okay. Why it's said that remedies are many of remedies can come, but the way you're approaching the remedy, or the way you're taking up your totality of the case, way you're selecting the symptoms is of importance, because the selection of the symptoms is a main skill which a homeopath requires. So, any of you who can share the totality? So we'll discuss the totality of the case. So totality here is generalities, weakness, morning rising on, abdominal pain, umbilicus in the morning, head pain aggravated in the morning, head pain, vomiting after, head pain, pressure amelioration, lying on left side amelioration, desires for salty, thirsty, dryness of tongue, perspiration, aggravation while eating, hot patient, fear of dark and quarrels, and a reserved patient. So the remedy which I gave was Natrimur 30. So this is the repetization. You can see the probable remedies which had come up. So this case particularly, this was cured with Natrimur 30. So I didn't change the remedy, or I didn't have any other remedy. I didn't give any other remedies following the this remedy. So this entire case, it settled on simple medicine and a simple potency, that is 30 potency. So any of you, you can ask me questions related to the case and the session. I'll just try and see if the video is being played. So you can just ask the questions.
Thank you, ma'am, for the enlightening session. We are grateful to you.
Hmm.
This question is for you, ma'am, that thermal is important in surgical cases or acute?
Yes. Thermal plays a very important role in any kind of cases, basically. Let it be chronic, acute, or surgical. As thermal, it is mostly denoting the body physiology. So, okay, surgical case, it differs, okay. So if you're having a case of severe head injury, where the acute head injury, where there is a severe blood flow, and you need to prescribe a remedy. So you can't prescribe a chilly remedy to a hot patient. So there you won't get a result which are like quick and 100% result. And in acute cases, if you say, so acute cases, the most important part of acute cases is thermal, because it mostly thermal is the thing which changes sometimes in the acute. The hot patient may become chilly, and a chilly patient may show the hot symptoms. And especially in the cases of fever, so you should never overlook the thermal. So there is a book of Dr. Amasya Nikam, which is solely based on the research of thermals. So when you go through Organon of Medicine, there was this portion was lacking, that there was no much information on thermals which was provided, and why the thermal is of importance. So this book includes everything. You can go through this book also, but I'll say that it is very much important to consider in both the cases. Okay, thank you. I
And
think
ma'am,
next
Dr. Saurav Sharma is also asking that why you have given 30 potency and not 200 or 100.
Mhm. Yes. So 30 potency, it is the like it is a most importantly in such cases, critical cases, or the such acute severe cases, it is very important to start with the basic potency. And this 30 potency, as we have clinically researched it, and we have been practicing for so many patients, and so many years after a thorough research, we have been observing that 30 potency is the only potency which shows the quick actions in the patient. And other thing is that you can easily observe and switch on for the remedies if it's necessary. The patient shows different kind of symptoms, or if the patient doesn't show the improvement, you can switch on for the remedies easily in 30 potency. There is no harm to the patient. It is minimal potency, and there is easy way to observe the patient, or easy way to switch on to the other remedy without thinking much in the number of like potencies or time. So there is very time limiting period for such cases, as you discussed, the renal colic or gallstone colic or pancreatitis, acute kidney injury. So this, in this cases, the time is a very important point. So you should able to give results very quick. So 30 basically has good results. Okay, thank you.
Thank you, ma'am. Thank you for enlightening us. Ma'am, you can stop your screen share. Thank you. There is a question for Dr. Yashika, ma'am. Ma'am is joined with us.
I'm here, Niharika, I'm here.
Yes, yes, ma'am. There is this question that kindly share some clinical tips to differentiate headache due to ischemic attack versus migraine during the query session. This question is asked.
Okay. So I think the question was the headache which occurs during the ischemic attack when there is some blood which is being getting accumulated. There is some blockage. Otherwise, and the comparison was with the migraine, no? Yeah.
Yes.
So when you, I think there is arnica which comes into everyone's mind. Arnica, glonoid. When there is rush of blood, extravasation of brain, and such symptoms which come up during ischemia or ischemic stroke or whatever happens, like there is some hemorrhage or something inside the brain, and the headache is occurring due to that. So arnica, hypericum, glonoid, gelsemium, in fact, these are some of the remedies which act good. And when you talk about migraine, we already discussed so many medicines. So anything which is symptomatically similar, so that can be chosen.
Thank you, ma'am. Thank you for enlightening us. We would now like to take the privilege to honor our speakers with KHA appreciation certificates. Please accept it from KHA Homeopathic Study Group.
Yes. Thank you. Thank you so much for having us. It's always good to join, or good to have such people who work always for the betterment of homeopathy and are passionate equally about homeopathy. So it was I was very glad and delightful to join the KHA Homeopathy group and discuss with you all. Hope the session went good. The videos couldn't be played, but let's see. We'll try it better next time. Thank you for having me. Thank you, Dr.
We're
Niharika.
glad that you are here, ma'am. Thank you.
Yeah.
This is for Dr. Manasvi, ma'am. We would like to present you with the certificate.
Thank you.
Dr. Yashika, ma'am, please accept our certificate.
Thank you so much. Thank you so much, Niharika.
Thank you everyone for being present here. Before concluding, I would like to announce the upcoming May webinar that will be on 5th May 2024 at 8:30 p.m. IST and 10 a.m. EST US and Canada time. And I'm also excited and to announce having the KHA 4th annual celebration along with the award ceremony on 5th May 2024. For the webinar on 5th May, we will have with us Dr. Manish Bhatia as our speaker for the day, who will enlighten us on the topic becoming a better homeopath. You can find the link to register to our website and don't miss the webinar. Our website is kavitakHomeo.com. Also, the link for participation certificate has been mentioned in the chat box. You can fill it and grab your certificates. Heartful thanks to our viewers and followers who have joined us today. We have many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. For the upcoming webinars, you can follow us on our social media handles. And if you have missed any webinar or you want recordings, then you may visit our YouTube channel, Kavita Kukunur. I'm thankful to KHA volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. For other information or for joining us, you can reach us at kstudygroup@gmail.com. Thank you very much. Thank you.